In the mid-'80s, an architect, frustrated that healthcare clients didn't seem interested in using design to improve patient outcomes, started a conference on healthcare interior design. About 500 design professionals, product manufacturers, and healthcare executives came to the first conference in 1988, marking the beginning of the healthcare design community. I was hired in 1989 to produce and run the conference, which quickly developed a reputation as a forward-thinking, people-focused, idea-generating forum. After several years, the board and staff realized that there was a need for more than just an annual conference. Anecdotal evidence wasn't enough to convince decision-makers to invest more in new facilities to implement these ideas. In 1993, we created a nonprofit organization to help promote research and develop additional resources for the healthcare design community. The Center for Health Design, or CHD, was born. Our current objective is to spread knowledge and innovation faster while expanding our reach. We want to be better known as a thought leader, an information bank, a generator of valuable resources. This information will positively impact outcomes and encourage people to design in a manner that improves the patient experience, reducing infections and errors, for example. In order to reach new audiences and respond to the rapid change in healthcare, we need funding to grow our online presence, which is the vehicle that allows us to educate and build community without the boundaries. We need to expand our membership base to include healthcare facility leaders to engage in the national conversation about healthcare reform and the role the physical environment can play. We create maximum impact with limited resources. Our staff remains relatively small, but by leveraging the passion of a wide array of people, we accomplish a great deal. We've built partnerships with organizations and people who help us move ideas into reality. We've also been fortunate to work with healthcare administrators who work in facilities whose culture allows them to implement new ways of providing care. We've collected research that directly connects built environment decisions to outcomes. The Center has been instrumental in taking that knowledge and making it actionable by turning it into tools and resources. We're committed to improving the healthcare experience. This allows us to easily change directions and adapt to fluctuations in the industry. We've also been fortunate to have dozens of successful and well-connected individuals serve on our board of directors or as supporting partners. They've helped us continually challenge ourselves and make connections to other individuals and organizations that help spread proven solutions. The best way to use our strengths is to leverage the complementary strengths of others. We want people to utilize our knowledge, but an even more important metric of success is the impact our resources and tools have. We want the public to understand that healthcare environments have an impact on the quality of their care and their health outcomes. We want healthcare facilities to understand the value of the evidence-based design, or EBD, process. The third measure of success is a robust healthcare design field that incorporates EBD into all of their designs. Additionally, there will be more academic institutions that incorporate EBD into their curriculums. Finally, research will continually be undertaken and added to the current knowledge base. All of these factors will lead to the most important and final measure of success, an overall improvement in patient outcomes. People often assume our work is about making hospitals pretty. The relationship between the built environment and outcomes isn't often discussed. While aesthetics are important, they're only part of the equation. Our work is about helping people create environments that use design to reduce stress, human factors to reduce errors, and nature to promote restoration and peace, so that people can fight the disease and not the environment. Over the years, we've created a community that has fundamentally changed the way healthcare facilities are built. Hundreds, if not thousands, of healthcare facilities around the world are built using research and, as a result, are more patient-centered. By utilizing the built environment as a tool, long-term hospital operating budgets can be reduced. The capital expenditure required to build a new hospital is insignificant when compared to the operating budget. By investing in a better environment, the building will continue to positively impact long-term costs and the patient. Engaging the healthcare community is a challenge. It's imperative for us to be present at the moment when having access to our body of knowledge could help make key decisions. Providing healthcare administrators access to our resources during the pre-design phase of their building projects ensures the appropriate strategies can be incorporated into the design to improve outcomes and reduce costs. After the design phase of a project, it's less realistic to include our innovative research-based ideas. For this reason, we think it's necessary to make stronger connections to key healthcare facility decision makers so we can provide the right information at the right time. With additional resources, we'd be more engaged in national conversations about healthcare reform to expand our knowledge. We'd use this new information to create better resources and tools for an expanded audience, including healthcare administrators. Among these would be new consulting offerings, best practice and peer-reviewed research, case studies, design checklists, audit scorecards, and cost calculators. We'd form a new learning community by offering workshops, webinars, and focus groups. The Affordable Care Act has brought about a great deal of uncertainty and challenges for the healthcare industry. Administrators must be focused on providing value-based care. For CHD, this means providing information that demonstrates how the built environment can enhance quality of care and ensure the safety and well-being of patients and staff. The new tools we'd like to build will do just that. For example, healthcare administrators will be able to easily understand how best practice design strategies can prevent hospital-associated infections. In addition, they'll be able to use a cost calculator to demonstrate the financial savings brought by implementing those design strategies. With these new tools, CHD will improve the decision-making process for new construction, renovation, and many other projects.